Dr. Cameron Edgar from Edgar Family Chiropractic, talking about some of the most common conditions we see in the clinic. And today we're going to talk about foot and ankle injuries. So when people come in with foot and ankle injuries, our first thing to do is to do an assessment to figure out what it is that is actually going on. It could be something as simple as an ankle sprain from playing sports. It could be something to do with their circulation. It could be something to do with if they have arthritis in the ankle, metatarsalgia, which is pain in the ball of the foot, plantar fasciitis, which is pain kind of on the arch or the bottom of the foot. So once we have done this assessment and we know what's kind of going on, then we can direct our treatment at the appropriate areas. Some of these areas could be the tendons or the muscle of the ankle and down to the foot. Sometimes it's the actual joint. One of the things we might have to do is reduce inflammation or pain if it's an acute injury. So we do that using modalities such as ultrasound, ice, sometimes some therapies to bring down the pain. Once we have done that, a lot of times we want to get into the muscles in the area. Hands-on, we want to get in, muscle stripping, loosen up the tendons in the area, whether it's the bottom of the foot or up into the calf. Then what we want to do as well is give them some homework, so some stretching and some rehabilitation exercises they can do to strengthen the injured area that's happened. If it's more of another condition, that might be kind of outside from the hands-on perspective. Sometimes we'll give some things like compression stockings if it's a circulatory issue. We also have things like custom bracing if it's an ankle sprain so they can get back to their sports or work faster. All these different things are able to work together to get the patient pain-free and back to their normal life.